I wanted to be a doctor after watching what healthcare was like for my mom and my dad. They were both immigrants. My mom's Haitian. My dad is Dominican. My dad had 3 jobs at one point. My mom had 2. And there were 6 of us. So I literally watched them work day and night. And they would take kind of shifts to just make sure that like we could go to school. But whenever they got sick, they never went to a doctor. One of it was the cost. And then the other is not having English be your first language, especially back then. It was very easy to be discriminated against. So sometimes we'd be able to find, a Spanish-speaking interpreter. That was great, but it didn't help my mom. So then sometimes I would go. And so you've got my mom, who's an adult, with her 10-year-old, who's her translator. And I watched the difference in how she was treated when I was there and how other people were treated. And I was like, I want to do something where people like my mom, who work hard and they deserve to have care and they deserve to be treated like everyone else, can actually have access to that. And so I actually taught myself Spanish. I taught myself Portuguese. And I figured if I'm going to be in Florida, I need to know how to cater to essentially my people. So went to med school. First one to do that, had no idea what I was doing. Right? And I realized there that just didn't expand to just brand new immigrants. It's everyone. At some point in time, everyone goes through a time where, because you're trying to take care of just your basic necessities, you either don't have the funding, or you don't have a location that will accept you, or your insurance, or maybe it's just too far of a drive. And I said, I want to be the doctor that champions for those people.